welcome to Dr. Vibes, the learning point. In this video, we shall study the anatomy of thyroid gland. In today's video, we'll study about the anatomy of the thyroid gland. So here you can see this is the structure of thyroid gland, which is a butterfly-shaped gland, 2 lateral lobes and 1 isthmus. Behind the thyroid gland is your trachea, and you can see the cartilaginous rings in this. Each lobe of thyroid gland weighs 10 gram. Now come to the vasculature or the blood supply of thyroid gland. There are 3 main arteries: superior thyroid artery, inferior thyroid artery, and arteria thyroidea. Superior thyroid artery is a branch of external carotid artery, inferior thyroid artery is a branch of subclavian artery, and arteria thyroidica is a branch of arch of aorta. Now there is one clinical correlation in this. If the arteria thyroidica gets obliterated, that is, this artery gets obliterated, it leads to a condition called as levator glandulae thyroidis. Okay. Now come to the venous supply of thyroid gland. Each artery is associated with a vein. Superior thyroid artery, so you can see this to be a superior thyroid vein. This is the inferior thyroid vein. This is the inferior thyroid artery. This is the inferior thyroid vein. There is a middle thyroid vein as well. In veins, you have to know where it drains. Superior and middle thyroid vein drains into internal jugular vein. These two will drain into the internal jugular vein. The inferior thyroid vein drains into the brachiocephalic vein. And sometimes there is a fourth vein also. There is a fourth vein also, which is called as the fourth vein of Cocker, and again that drains into the internal jugular vein. This may or may not be present. So in this page, we have studied the anatomy of the thyroid gland, the 2 lateral lobes, isthmus, the trachea behind. We have studied 3 arteries, 1, 2, 3. We have studied 4 veins, 1, 2, 3, and 1. That is the fourth vein of Cocker. Now we come to the nerve supply of the thyroid gland. Here is the theory written for the nerve supply of thyroid gland. See, beside the superior thyroid artery, there is the first nerve, that is superior laryngeal nerve. Superior, so superior laryngeal nerve. And here is the recurrent laryngeal nerve, not the inferior laryngeal nerve, but the recurrent laryngeal nerve. This is in proximity with the inferior thyroid artery. Now, these two nerves, superior thyroid nerve, superior laryngeal nerve, and recurrent laryngeal nerve, both are the branches of the vagus nerve, branch of the vagus nerve. Now, the superior laryngeal nerve gets divided into external branch and internal branch. External branch will supply the cricothyroid, and the internal branch will supply the thyrohyoid muscle. And the recurrent laryngeal nerve, that is in the right side, that is the left side. In the right side, it hooks around the subclavian vessels, and in the left side, it hooks around the arch of aorta. Now, recurrent laryngeal nerves has a motor sensation, has a sensory sensation. A motor supply or a sensory supply. Motor will supply all the intrinsic muscles of the larynx except the cricothyroid, because cricothyroid is supplied by the external branch of the superior laryngeal nerve. And also the sensory supply, which will supply the vocal cords to the carina. So 2 nerves, superior laryngeal, recurrent laryngeal, 3 arteries, superior, inferior thyroid arteries, and arteria thyroidica, and 4 veins, middle thyroid vein, superior thyroid vein, inferior thyroid vein, and the vein of Cocker. Now, the clinical correlation with the nerves. Now we'll see what happens on the injury of these recurrent laryngeal nerve and the superior laryngeal nerve. Now, if the recurrent laryngeal nerve is damaged in the unilateral side, that is one side, there will be hoarseness of voice. And if the recurrent laryngeal nerve will be damaged both the sides, then there will be stridor and dyspnea, and immediate tracheostomy has to be done. If there is damage to the external laryngeal branch or external branch of the superior laryngeal nerve, then the timbre of the voice will be lost. Now, one question which comes from the nerve supply is there is a condition called as dysphagia lysoria. Dysphagia lysoria. What happens in this condition is that the esophagus gets compressed by an aberrant right subclavian artery, which causes dysphagia, and also the clinical presentation that you see is a non-recurrent laryngeal nerve on the right side.